School's out, but infections are up. And with cases jumping in children, 12 to 15-year-olds can now join those booking jabs online. 14-year-old Joseph's already had his.
It just felt right to get it because after being in lockdown for 6 odd months, I'd seen what it was like to just be locked in a room, locked in a house for that long. So I just did not want that to happen.
I think it's really important, especially with the rise in the age range, because they've had many cases and before the last lockdown, of course, it meant that the whole year group would have to close.
Gelja told me she wanted her 12-year-old jabbed.
Even though there's a bit of hesitation, yeah, we still let him have the first jab.
And you weren't too worried about that?
No, not. And then also after the jab, he was fine, completely fine. No temperature at all, just a little bit of tenderness, but he was fine.
But neither Kayana nor her mum Tia are convinced.
I'm going to give it a couple more years to see what's going on, and then she will have. I don't want to be pressured and rushed into anything because right now they don't really know what's going on themselves.
In England, the rollout among children has been slow, but in Scotland, drop-in clinics and a special bus have sped things up, and teenage vaccination rates are much higher.
I was at a vaccine clinic yesterday and there were many young people, I assume in that age group, just dropping in. A couple of our more rural health boards, they've still been doing it in schools or with appointments, but I think the convenience, we reached 50% just yesterday, I think, is the biggest driver.
The government says it doesn't want to reintroduce restrictions, which is why, for now, ministers are sticking with Plan A to get as many as possible vaccinated, from first jabs to boosters.
This clinic in Birkenhead was busy, but rates across the country remain slow.
If you ask my professional colleagues in the hospital, they'll tell you that the people who are going to the hospital are younger people who have not been vaccinated. So the vast majority of the people who are being admitted to hospital are unvaccinated and more younger population. 12 months ago, we were all talking about older people, vulnerable people. Now it is the unvaccinated younger people who are becoming the vulnerable people.
And perhaps a sign there are worries, Number 10's asked a former vaccine chief to return to her role. The half-term holiday has started, but there's no break from COVID. The government needs vaccine rates high to help keep infections down. And time, meanwhile, is running out. Laura Bundock, Sky News.